Does acupuncture help with headache? Acupuncture can prevent migraine attacks and tension headaches in the short and medium term. And apparently it doesn't really matter where the needles are. Even if there is still a dispute about whether acupuncture points are important or whether it is just a matter of positioning the needles somewhere at all, the results of two large meta-analyses leave little doubt as to the short and medium-term effectiveness of acupuncture in headache patients. For pain prophylaxis, the procedure is sometimes even better than treatment with medication, say leading doctors. For the Cochrane collaboration, doctors evaluated 22 studies with over 4,400 patients on acupuncture for migraines, in a further analysis 11 studies with around 2,300 patients with tension headaches. The studies had to last at least 8 weeks and have a control group in which either drug therapy, no treatment, pseudo acupuncture, or other non-drug procedures such as massage or relaxation techniques were compared. Of the 11 studies on tension headaches, doctors examined in 2 large studies whether acupuncture had an additional benefit in patients treated with drugs for severe pain. The combination of acupuncture plus medication was clearly superior to purely medication therapy. 47% of the patients with acupuncture reduced the number of headache days by at least half, but only 16% with pain reliever therapy alone. Acupuncture was compared to a pseudo treatment in 6 studies of tension headaches. The therapists either did not place the needles at the correct acupuncture points or they did not penetrate the skin. In these studies were a significant difference between correct acupuncture and pseudo treatment, but the difference was not very large. In 50 versus 41% of patients, the number of headache days fell by at least half. In 4 studies, acupuncture for tension headaches was compared with physiotherapy, massage or relaxation exercises. Here acupuncture was slightly inferior to the other methods. However, because these studies had shortcomings, the results are difficult to interpret. A similar picture emerged in the 22 studies with migraineurs. Acupuncture for seizure prophylaxis was tested in 6, in some cases very large, studies, with the control group not receiving any prophylaxis. The success rate, defined as having the frequency of seizures, was around 50% with acupuncture, without 25%. The number of headache days and the pain intensity were also significantly lower after 2 and 3 to 4 months with acupuncture than without. In the only long-term study, the success persisted even after 9 months. However, if, as in 14 of the studies, acupuncture was compared with various pseudo-acupuncture methods for migraines, no significant differences were found. The number of headache days fell similarly in both groups, the frequency of attacks was similarly high and the use of analgesics did not differ either significant in the 2 groups. Acupuncture performed slightly better than drug prophylaxis, such as beta blockers. The response rate was around 20 to 35% higher with acupuncture in 4 studies, and the rate of adverse effects was at the same time half lower than with drugs. At first glance, these results appear somewhat contradictory. Acupuncture is at least as suitable for prophylaxis as drugs, but it is obviously of little relevance where doctors put the needles. There are several explanations for discussion. The placebo effect with acupuncture may be particularly high. The intensive contact with the therapist, a slightly painful procedure and a relaxing situation during the sessions, all of this increases the placebo effect. It is also discussed that the needles stimulate nerve fibers, especially the non-myelinated C fibers, and thus influence the perception of pain. Another important point, except in studies with pseudo-acupuncture, no blinding was possible. Many patients dropped out of the studies when they were placed in the control group because they had hoped for acupuncture. This, as well as the obviously positive expectations of the patients with acupuncture, could also have distorted the results. Presumably, these effects all occur together and result in good overall effectiveness of acupuncture.